Hey there, it's Dr. Jim, and I have an interesting topic for you today. It deals with accelerating death, hastening death, when the diagnosis is dementia. It's a heavy topic. Some people might consider this a dark topic. I do understand, as I did my research on this, we're talking about morals, we're talking about ethics. We're also talking about people's quality of life. And when it's time to go and they want to go, who's in charge of that? Okay. So wherever you are in terms of spirituality, your religious background, I have mine. I have my beliefs for sure. This is a topic that might strike some nerves. I mean, we're talking about a doctor helping me to end my life when I have dementia. So let's talk about this, okay? It has been well known for some time now that the diagnosis of dementia, whether it's Alzheimer's disease or some other form, is a terminal illness and eventually a death sentence. I know it's hard to sugarcoat this topic. I usually like to have a great time with topics. This one's a little tough. Bear with me. Some countries, including Canada, Spain, Belgium, and the Netherlands, have legalized advanced euthanasia for individuals with terminal health conditions, including advanced cardiovascular disorder, treatment-resistant depression, and dementia. Despite this being a deeply personal and ethical issue, and heavy disagreement for it and against it are going to happen, people do have decision-making rights on how they die, or how they might die, or wish to die. When we're talking about accelerating death, when the diagnosis is dementia or another terminal illness, it's important to review the Patient Self-Determination Act. Okay, so let's frame our discussion within this act. Effective since 1991, Congress passed the Patient Self-Determination Act as federal law. It empowers people regarding their healthcare decisions and ensures that they are informed about their rights concerning medical care, advance directives, and end-of-life treatment. It also includes the right to accept or refuse medical treatment, even when it means that doing so may cause injury or accelerate death. Healthcare providers in hospitals, skilled nursing homes, hospice, home healthcare agencies, they all have a clear obligation to inform patients of their rights under this law and to make decisions about medical care and the right to accept or refuse care or treatment that will prolong their life. So, accelerating death. What we're talking about are end-of-life decisions. It's not a pleasant topic for a lot of people. The individual and healthcare professionals providing care may face three broad circumstances when making decisions about end-of-life care. This might be important to you now, could be important to you in the future. It might resonate with you because of a family member going through this. Me and my family and I, have gone through this many times. First, an individual with decision-making capacity. I'm alert, I'm oriented, I'm cognitively with it. That person can refuse some or all life-sustaining interventions, including food and water. Second, an individual who had cognitive capacity has lost that capacity due to dementia, due to being in a coma or something else. They no longer can make decisions, but they have an advance directive document that limits or fully rejects life-sustaining treatments, including hydration and nutrition. And third, the individual seeks active assistance in hastening or accelerating their death. Those are the three general circumstances that might occur. So if we're looking at accelerating death when the diagnosis is dementia, we have to look at options. What options are we talking about for accelerating death? Well, individuals who have terminal illnesses, including dementia and other treatment-resistant conditions, have a few options for quickening their death, reducing burdens to the family, and ending their suffering and pain, including the following. One option for accelerating death is refusing potentially life-sustaining treatments. This involves the choice of starting or stopping any potentially life-sustaining intervention, including cardiopulmonary resuscitation, CPR, mechanical ventilation, dialysis, antibiotics, artificial nutrition and hydration, and chemotherapy. Individuals can spell out in their advance directives exactly what they want and what they do not want concerning life-sustaining treatments to guide decision-making and care, even if they lose decision-making capabilities. So an advance directive is something living wills, your general will, power of attorneys, advance directives, those are really, really important documents to get together. Hard discussions, but important ones, necessary ones, I'll say that. Another option for accelerating death is voluntarily stopping eating and drinking. This option involves the individual's choice to stop eating and drinking by mouth with the intention of accelerating their death. This decision must be made by an individual who has clear decision-making capacity and is done so voluntarily. That's important. Another option for accelerating death: stopping eating and drinking by advance directive. Although this choice comes with unclear legal enforceability in some parts of the United States, probably around the world, it does remain an option for hastening one's death. It involves clear documentation to the individual's explicit preference to end feeding and hydration at some point in the future, when decision-making capacity is lost due to advanced dementia, unconsciousness, or coma. Now, this next one I've known about for a while. Another option for accelerating death is medical aid in dying, or the acronym MAID, M-A-I-D. Originally a Canadian policy, medical aid in dying has been accepted by some states in the United States and outright rejected by others. The purpose of MAID is to provide a natural death or an assisted suicide involving a physician who prescribes a lethal dose of medication at the patient's request and has been diagnosed with a terminal illness and a prognosis of 6 months or less to live. The individual must be competent to administer the medication themselves. States allowing this choice right now, as of the timing of this video, include California, Colorado, District of Columbia, Hawaii, Montana, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington State. So the question then becomes this. An individual has a terminal illness. Alzheimer's is one of them. Dementia is another one. There are many cancers and so many other terminal illnesses. Does the individual have the choice to hasten or quicken the death process. Reducing the burden of the family, reducing their pain and suffering. There are options. It depends upon the state they're in. Now the question becomes this: to hasten one's death or not? This topic is highly debated, laden with moral and ethical issues, and deeply personal and spiritual. On one hand, opponents believe that life is sacred and it is not to be ended by anyone, period. Simply put, no one has the right to end life, not even their own. Others worry about corrupt physicians who might pressure older adults and seniors, the poor, or disabled individuals to a quick death. That is a slippery slope for sure. On the other hand, those who support hastening of death believe it should be done as a last resort decision, but one that ends pain and suffering of the patient and the family. It might lessen physical and psychological burdens associated with a very long death trajectory or process. Here are my final thoughts on accelerating death when the diagnosis is dementia. Quickening one's death is most likely a topic that most people do not want to think about. They don't want to talk about it. You don't want to watch this video because that's my topic. I get it. It will become reality for many who suffer from chronic and debilitating illnesses that might cause great pain, great suffering for the patient and the family. And let's not forget the healthcare team surrounding the family and the patient, doing their very best to reduce the anguish involved in end-of-life care. Again, this affects a lot of people. So what should we do? Having discussions, difficult discussions, documenting wishes in one's advance directives, and deep thinking on this topic, and then seeking a moral choice that is deeply spiritual, deeply personal. These are all going to be needed to make this very complex and final decision. So there you have it. I'm Dr. Jim. I'm the joyful gerontologist. I'm not the doctor of death, that's for sure. But it's something that we might have to think about. Accelerating death when the diagnosis is dementia. Where do you fall? What side are you on when it comes to this? Email me. Let me know. jim@collinslearning.com. Of course, keep coming back to my blog, drjimcollins.com, because I keep researching, reading, and continue to share important bits and pieces of information for you, your family, and your colleagues. Take care. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.